Hi, so I'm Kerry Belba, and I'm Kerry Muggeson. Two Kerrys when we are both executive board members of the British Medical Laser Association. And together we coordinate the nurses and therapists section of the conference. So I'm not medical, but Kerry is. So you work at Bedford, don't
I
you?
do. So I work at Bedford Hospital. I'm the specialist laser nurse and manager of the plastic surgery and laser department. So we're here today to get more interest in the nurse and therapist section of the BMLA.
Absolutely. I think historically, a lot of medical, people, nurses would be attending the conference, but we're trying to increase the aesthetic section. And I think, unfortunately, the name British Medical Laser Association, people might sort of think that it's not appropriate for them, but it's been amazing, hasn't it, the conference this year?
And there's so many things that, I mean, even just the networking for nurses and therapists to get together and chat amongst themselves about what they're doing and treatments that they're carrying out. And I think, that's what the BMLA does.
Absolutely. And I think, I've been speaking to therapists today saying they were really surprised that, they covered laser hair removal here, pigmented lesions. And I think and in fact, one therapist said it was fantastic hearing a senior dermatologist speak about pigmented lesions and actually being able to take that information back and apply it into their very cosmetic and aesthetic setting.
I think the courses have gone down quite well as well, haven't
Yeah.
they? And I think, like you're saying, there's more nurses and therapists booking onto the courses now, which again helps their practice, doesn't it?
Absolutely. I mean, at the end of the day, there are always going to be people who are happy to come in to their clinic, turn the laser on, do their work, turn it off and go home. And there's kind of nothing wrong with that as long as they're following protocols and safe practices. But if you want to be at the absolute top of your game, if you deem yourself to be a laser expert, then you can't really miss these conferences.
No, not at all. And like I say, after the conferences, you've got contact to speak to people outside the conference times. And I just think that that's so important for your practice to make sure you're up to date and current with, with legislation, with protocols, with processes. And I think the BMLA does that.
And as someone pointed out to me today, lasers like everything else, it's constantly evolving. Things that were deemed to be the safe or just good practice, change. And you're only going to hear about that, at the BMLA conference. Or if you hear it secondhand, it's because your competitors down the road have been doing it for 6 months already, and you don't really want. And when you're a laser practitioner, you don't want to be following on behind everyone else. So you want to be absolutely doing the best practice, safe practices, right from the word go. So next year in Cardiff, we are in Cardiff. And the year after that, we're going to be eating tapas in Spain.
Oh, exactly. You want to come to Spain.
Exactly. So, but in all seriousness, you want to really be a member. It's £45 a year. It's nothing, is that?
And also, if you want to get in touch with either myself or Kerry, regarding anything nursing wise, therapist wise, feel free to contact us through the BMLA. And if we can help you with your practice or point you in the right direction, then we're here to help.
Absolutely. And then come and see us in person in Cardiff next year.
Yeah. Be there.
Or be square. See you now.
Bye.